Welcome back to Talk of the Town. We're talking about seeing clearly.
Well, and we're going to continue our discussion about 21st century eye care. So welcome back, gentlemen.
Thank you.
Thank you.
And I think we're going to focus more about some of the options that we'll find when we walk in your door.
And you actually had an experience with your contacts. You were having a hard time when you...
Oh my goodness. I'm sure, gentlemen, you have customers, clients, patients who come in with lots of problems, right?
We do.
Absolutely, absolutely.
And you are equipped for those problems.
Of course. We offer a full service optical. We do full eye exams, treat dry eye, glaucoma, macular degeneration. We really see it all.
For myself, Phil, when I walked in and met these fellas, I was really kind of at the end of my rope with what options I had, everything that I had exhausted. I have terribly dry eyes, which means contact lenses are an hour or two of wear was all I could get out of my contacts, and then my eyes would hurt for the rest of the week. And glasses are so cumbersome and in the way, and LASIK scared me.
And that's why you were giving me such a hard time all the time.
That's exactly, that explains it. And so, you know, Dr. Bartels came in and said, well, let's explore some of the options that, you know, as a patient, I really did have, that I thought those options didn't exist.
And there are a lot of options, right?
Yeah, we have a lot of new technologies. In Kim's particular case, we were able to fit her with a new, brand new material, Total Dailies from Siva, and they're a wonderful lens for dry eye patients. And they're a one-day lens. You just wear them one day. And I think Kim, as she said, she was at the end of her rope. She was very uncomfortable. Obviously, being in the public eye, she wanted to wear contacts, not glasses, on these shows. So we were excited that we were able to fit her, and you can.
Well, now I'm wearing contacts from the time I get up in the morning until the time I go to bed. My eyes feel great, and I've had nights where the contacts were so comfortable, I fell asleep wearing the contacts, woke up the next day, and my eyes still felt just fine.
The reason that lens works is because it's water gradient technology, so it's almost 100% water at the surface of the lens, and there's a blink activated moisture that's released, you know, throughout the day. So it keeps your eye hydrated.
I can't say enough about these lenses. If you have issues with contacts, if you have issues with dry eyes, you must see these gentlemen about these lenses.
We also have a lot of, you know, patients these days, I'm a little older myself, that need bifocal contacts, and we specialize in that area. So people that don't want to pull out their readers every 2 seconds and put them on and take them off, or wear glasses all the time, we do a lot of specialty bifocal contact lens. That comes, we do scleros with that, and we do, there are one-day bifocal contacts also, so there's a whole slew of different contacts technology available to us today to get better success.
And you're working with your patients as individuals to really find what's going to work, whether it's the corneal reshaping or the contacts for people with dry eyes or the bifocals. But let's not forget, glasses are still cool. Aren't glasses still cool?
Absolutely, absolutely.
We love glasses.
Glasses are a fashion statement.
Yeah, we carry quite a few high-end brands, and we have a whole slew of different products from Bulgari to
Tiffany, Giorgio Armani, IC Berlin,
I've
Mad
seen
in
their
Italy.
shelves. They have fabulous glasses.
So we're always changing them out, you know, keeping up with the styles.
And
no, glasses are back in vogue
too.
now. Yeah,
and sunglasses too. I think that a lot of women are now treating glasses the way that we treat shoes and purses. I have a whole shelf of glasses to go with different outfits and different hairdos. It's you know, the glasses of the day.
We're happy to oblige.
Well, I'm glad you brought up the sunglasses, because honestly, not just from a fashion statement, but from an eye health statement, you know, protecting your eyes from that UV sunlight is super imperative for reducing risk for melanoma, macular degeneration, cataracts at a younger age. So protecting your eyes with your sunglasses is important.
And I think we forget that you know, we've been taught and we're accustomed to protecting, you know, our skin and putting on sunblock. Right. But the idea that our eyes can suffer the same way that, you know, we can get a sunburn, we can really have damage to our eyes. And I'm sure that, you know, just picking up a pair of sunglasses at the dollar store isn't necessarily going to offer the
we have a whole line
protection.
of sunglasses for children. It's a smart idea when the kid's younger. That's when they're causing their, you know, damage to their skin. They're also causing damage to their eyes at a young age. So sunglass protection, UV protection is very important these days.
For the kids especially, as you mentioned, 80% of your UV exposure happens by the time you're 18.
Wow.
So really, your kid should be in sunglasses more than you are, to be quite honest.
wow, by the time you're 18, you've already done the damage you're going to do. Well, moms and dads, yikes.
And technology, even with sunglasses, has progressed. They have the sunglasses that change, darken as you
Yeah, they're called
go out into the
transitions. They're
sunlight.
changing quicker. They're always speeding up the process where it changes. When you walk outside, it's the faster, bigger, and badder. You know, it's like it changes quicker, so everybody gets, when you walk outside, it changes. Then when you walk back inside, it clears up.
And now there's the transitions that will transition while you're driving.
That's correct.
Those are great. So you're not trying to switch your glasses off when you're driving. It'll
Well, they have ones for inside the car. The problem with the car, UV protection is in your windshield. So that actually deactivates the process of changing the lens. And now they've come up with another process that actually works behind the car, behind the windshield. So
Really, because that never used to. When you get in the car,
Yeah.
your sunglasses never worked, the
Yeah.
transitions.
Can I talk for a moment about diseased corneas? Because
Yes.
we talked about healthy eyes and we talked about multifocal contacts, but one of the other things that we really pride ourselves on is helping people who have a condition called keratoconus. And this is a corneal disease where the cornea gets thinner and steeper and irregular. And it's quite debilitating for patients who have this condition. And we fit specialized contacts for that sort of a condition. And this is really a good platform for us to let people know that we offer that service, because it really can change people's lives and help them get back to work and live a normal lifestyle again.
We had a patient that actually was going to the retinal specialist thinking there was something wrong with her retina, and she came back and she saw us for the first time. We were able to fit her from 2100 to 2020, and she was very surprised. Somehow it got lost in the shuffle. She's at the wrong place, and once she came to us, we were able to improve her vision, and it's sort of like a miracle for her.
Well, sure.
It's exciting to watch these people go from like almost disabling vision to 20/20 vision sometimes.
When you have somebody who puts a contact in and they almost cry because they've never seen that well, it really makes you feel good about what you do every day.
And when somebody visits your practice, there's not 30 physicians there. I mean, you sit down and you spend time with your patients. It's an operation where you can actually take the time and
No, we're very, very proud that we've been able to help you guys out a little bit, and that you've seen the whole operation and come through, and you can see the one-on-one service, and it takes a lot of time to do these things properly.
Well, I can tell you, I've been to a lot of different places for contacts, for glasses. I've seen a number of eye doctors trying to find something that would work for me. You guys, you are the first eye doctors who I've been successful in finding a solution to this dry eye problem, which maybe doesn't sound like such a big deal, but when you can't see and when it hurts, when you're using what's available to see, it's a huge deal. A huge deal.
It's huge, and we appreciate your compliment, and we appreciate you coming in.
Well, same experience that I've had. I mean, I've been to other eye doctors, and when I go there, it's almost like I'm going to a factory. You know, I'm on an assembly line, and get in, get out, sit down here. Somebody spends a couple minutes with you, then you go to the next chair, then the next chair, then the next chair, then you spend 2 or 3 minutes with a doctor, and then you're out the door. And they just don't seem to listen. And when you go into your office, I actually talk to you. And
Well, we
it's
pride
what
ourselves.
that's a
that we're able
refreshing
to-
experience.
Yeah, the longer you spend with the doctor, the better the outcome.
Well, sure, and when you come back, it's not a different doctor,
Right,
You don't, the
yeah.
doctor of the week. I'm sure we've all been to places that sell contacts and glasses, and it's the doctor of the week, or a place where they say, "Bring us your prescription and we'll fill it." But then, you're distancing yourself from your eye care physician, and I would think that you're also then setting yourself up for more issues with your eyes. What other issues, do we need to be really aware of? We've talked about the sun. We've talked about some degenerative issues. I remember as a
One
young...
question I have is, how often should someone get an eye checkup? I mean, from children to, elderly, it varies, 6 months, a year. I mean, what is it?
Depending on your condition, I would recommend, usually it's an annual eye exam. And
I recommend every year to my patients. If someone has a condition, we'll see them more frequently than that, obviously, but I recommend a yearly eye check for sure. It's one of your most prized and precious, commodities. You don't want to, have something happen to it.
And
so.
I think most healthcare insurance companies cover a lot of the wellness.
Many people have insurance exactly that they're paying for, or their employer's paying for, and they're only going in every 2 or 3 years, and really it's a shame. They're paying for it already, they might as well take advantage of it.
Yeah.
Well, I think we can all agree that your eyesight is something that is one of your most valuable commodities. And your eyes, just even if you can see, if you have watery eyes, if you have itchy eyes, if you have eyes that are just slightly blurry, it can affect your whole world. And sometimes people just get used to the fact that you're wiping your eyes all the time, or you're blurry, or your eyes are uncomfortable, and you just learn to live with it. Well, you don't have to do that. You go get it checked out, and it can make a world of difference in your quality of life.
It can. And doctors, thank you so much for being here.
Thank you for having us.
Thank you for what you
Pleasure.
do for our community. And I'd like to thank you personally, because my eyes have never been better.
Thank
And
you.
we'll be back right after these messages.